Should President Obama really be taking a position on the use of reparative or conversion therapy in the treatment, and I use that word cautiously, of gay and transgender people, especially kids? The answer, it seems to me, is absolutely he should be. But first, a bit of background about how the president came to step into this. Last December, a young woman, Clal, committed suicide, attributing her suicide, at least in part, to the incredible pain and anxiety created having been subjected to the process of reparative or restorative or conversion therapy, which was aimed at turning her back into the boy that her family and some religious leaders insisted she needed to be in order to be a decent person and right with God. Very shortly thereafter, in January, a petition went up at whitehouse.gov, and since then, over 120,000 signatures have been appended to that, calling for an end to the use of conversion or reparative therapy. And this week, through his senior advisor, Valerie Jarrett, the president has added his support to ending the use of this therapy. And so again, I would ask, is it really appropriate for the president to step in on this issue? And again, I would say yes, precisely because the use of reparative or conversion therapy is not, as it is often cast, a gay rights issue. It is a public health issue, and very much in the domain of the president and the federal government. Not only is there no evidence that this kind of therapy works, there is overwhelming evidence that it not only doesn't work, but does terrible damage to the people who are subjected to it. And that has nothing to do with whether or not one believes that gay sex is permissible or impermissible, what they think the Bible teaches or doesn't teach about doing it. In fact, the reason the president should be stepping in on this, because the use of reparative or conversion therapy, I don't think is even for the person it's supposed to be treating, assuming they have an illness to be treated. In fact, I think the use of this therapy, however much those who practice it say otherwise, is actually for the practitioners, not their patients. It helps them avoid the complexity of suggesting to those who they believe can only have impermissible sexual relations, that they are consigning them to a life of celibacy and often of deep loneliness. This allows the ones who practice the therapy to feel, oh, there's a happy ending here for everybody as long as we can fix you. It turns out that if one believes that gay sex or choosing a different gender is in fact not allowed because of their religious beliefs, the very least they can do is own the full human price of holding that position. The very least they can do is be with those affected in the fullness of the pain to which they are consigning them. Perhaps in that presence together, new answers can be found. But the quick move to a happy ending, for which there is no scientific research, and for which there is much scientific evidence of the terrible damage done, this isn't a gay rights issue. This is a public health issue. And especially when it's done to kids, it's a kids' rights issue. And so whatever one believes about gay sex, transgender decision-making, or anything else, it seems to me the president is to be applauded for taking this position on this issue at this time.